Dragons, here at RCHT we have a challenge. I'm Melissa and I'm part of the Amputation Working Group.
My name's Tamzin.
My name's Paul.
And I'm Jenny, and we're asking for £3,127 to invest in producing support packs for amputees, their families and carers.
70 patients per year undergo a major amputation. This is higher than many other areas in the UK. It's actually 1% of the entire UK amputee population. The reasons for this being an increased comorbid and elderly population. Despite this, we have no local prosthetic centre, fewer rehab beds and minimal rehousing options. The majority of amputations performed at RCHT are that of the lower limb. Amputations are not undertaken lightly. Patients will often have had other interventions to attempt to save their limb prior to undergoing major surgery. Historically, amputee care has been vastly underfunded. To explain the need for investment in our idea towards providing the brilliant care our patients deserve, let me introduce Bob, whose name has been changed to maintain confidentiality.
So this is Bob. He was admitted to RCHT with critical limb ischemia. Unfortunately, we have no other option other than to offer him an amputation. He's seen by various healthcare professionals, including the consultants, physios, OTs, pain specialists, and given 15 plus leaflets and told that he needs to inform the DVLA of his surgery. Understandably, Bob's quite worried about this. He's worried he's not going to remember everything. Good news bit, his surgery goes well and he's discharged 10 days later. When he's at home, he's talking to his wife, and his wife believes that he should be doing one thing, he thinks should be another. And unfortunately, his daughter took his washing home, which also had the leaflets in. Unbeknown to Bob, his granddaughter made a lovely paper chain out of the exercise plan. So that really isn't of any use anymore to Bob. That night, Bob feels tingling where his leg used to be. And he's sure he can wiggle his toes that are no longer there. He's so scared and concerned and worried, frightened. In the morning he phones his GP and his GP advises him to contact the vascular team here, which he does, and Paul and I set him on the correct path.
Okay, so after talking to Bob and other amputees, the Amputation Working Group surveyed all the patients who had undergone amputation in the previous 2 years. This was a copy of the survey that we used, and the result of this gave us mixed results. On the plus side, we produced brilliant care for all of our patients. Although there were some areas of concern, 20% didn't feel that they were particularly informed regarding the rehabilitation process. 30% felt that they weren't prepared for post-op practicalities, and 67% felt that they didn't know how or where to access help if they needed it. Also, patients reported having to wait several months to see a prosthetist, during which time they had minimal physiotherapy and they reported low mood. And then as a result of this, they also explained how living in a rural area isolated them, and coupled with poor access to public transport restricted them and attending local support groups. One thing we heard time and time again was that patients were giving a lot of information but couldn't remember it all, especially the exercises, and frequently misplaced leaflets. There was an obvious need to better assist and inform this group of patients regarding their support and exercise.
So Eureka, the amputee pack, was born. So this is going to include all information in one place, easy access for the patients. You've got your charity information, your exercises, learning about amputee lifestyle and knowing you're not alone. So the main thing we want to include is a DVD. So this is going to remind amputees of how to perform their exercises and how to complete safe transfers, which we hope will reduce the risk of falls and recurrent admissions to the hospital. So most of the investment we're looking for, so just over £2,500, is for the DVD creation. So we only have to do this once, and then the cost of the reprint is minimal. So as you can see, this is an easy, cost-effective solution, and with your investment, we can help to hundreds of patients improve their quality of life. Thank you.
Got a question that you want to kick off with, Adam?
Sounds great. DVDs. What about just a film that is posted on an internet site somewhere?
So that is the plan as well, but we know not all of a lot of our patients are over 70 and not all of them have internet access or a smartphone. So we want to make sure that we provide at least a few DVDs for those patients that couldn't access it. But yes, putting the clips on a site is planned.
So is the cost mainly in the making of the film
Yes.
rather than actual?
Yeah.
Right.
Yeah.
Okay.
That's good.
And may I ask about the rest of the pack? Is the rest of the pack physical? Is it leaflets all in one?
Yeah, so this is an example pack that we currently supply, but it does come in dribs and drabs. There are a lot of people that give out various leaflets, so like we said, things get lost. So we want to produce kind of a nice folder file that patients can keep all this information in, so they've got paper copies as well as this digital form that they can look to and advise with.
Because normally my instinct would have been to say, surely we want to pull that all together in a digital document. But of course, listening to what you've just said, presumably the average amputee is perhaps not in that demographic where that's so easy. Okay, thank you. Anything from you, Kim?
Is it going to be available and easy read? Because often, you know, as you say, with the population, and is that encompassed in your bid, or is that something extra we could look at?
That would be something extra to look at. Yeah.
Yeah. Okay. Thank you very much indeed. Great job, team. Thank you.
Thank you.
Well done, great pitch, really great.
Okay, so how was your pitch to the Dragons?
Brilliant.
Yeah, I think about pretty good.
Yeah, I think we got the point across really well.
Good. Did you get any feedback from them?
Just a few questions, really, but
They seem to like the idea.
Yeah.
I think it-
bits to think about.
Yeah, I think it was important that we came across in a positive manner, and that we were going to have a good impact on patient care, and that it was going to be sustainable for the future.
Yeah, fantastic. Well, fingers crossed for you. Hope you do well.
Thank you
very much.
Thank you.